Good evening. My name is Damon Knight. I am 67 years old. This is my second time on here, and I wanted to create a diary. It's sort of a journey of my health care. I know there's an awful lot of people that have similar problems, perhaps not as many, perhaps a lot more. But I'd like to go over and let you know that if you keep a positive attitude, nothing can stop you. Generally, I am a diabetic. For 18 years, I have neuropathy in my hands and my feet, which means I cannot feel when I do something. Like, for example, I'll try to button up a shirt. I can't feel the buttons. I have to actually physically look at the button in order to button it. For my feet, I miss balance, coordination. It feels like I'm walking on eggshells or perhaps little pieces of cotton, like cotton balls. But something exciting happened yesterday for me. I'll go into it later on, but I've had an awful lot of foot problems, primarily with my left leg. About 7 years ago now, I had a quadruple bypass surgery, and in order to do the surgery on my heart, all my veins, arteries were plugged up that went into my heart. They said 99% of my veins or arteries were plugged up. In fact, when I went into the emergency room, they put me on a gurney and wired me up with the EKGs, and I was laying there waiting for a doctor to see me. And as I looked, right across from me was the restroom, 6 steps away. If you look down on the floor, there are tiles. They're 12 by 12. And as I lay there, all wired up, I'm counting 1, 2, 3, 4, 5, 6 doorway to the restroom. So the first nurse that came along, I asked her, I said, I have to go to the restroom. Can you disconnect me? And she said, no, and walks away. Oh, that's nice service you got in this hospital. A few minutes later, another nurse came by, and by this time, I'm pretty well needing to go to the restroom. I'm not joking with it. I'm an old man, and I can't hold my water. And I said, I'd like to go to the restroom. It's only 6 steps away. Please unhook me. I need to go. She said, I'll get you a bedpan. I said, I didn't ask for a bedpan. I don't want a bedpan. 1, 2, 3, 4, 5, 6 steps, unhook me, let me go to the restroom, and you better do it pretty quick. And she says, no. She says, I want you to look down. Look down off that gurney and look at the ground. You think that's ground for you? She said, absolutely not. Make believe it's fire. From now on, that's fire, and you cannot step in the fire. And I said, it's a bunch of nonsense. I said, unhook me, I have to go to the restroom, or give me one damn good reason why you're not doing it. And she said, Mr. Knight, he says, at the present time you're having a heart attack. Is that a good enough reason? I said, okay. She says, the next time your feet touch the floor, you're going to be in ICU. Now, ICU in the hospital means you get put into a glass cage. There's usually probably one nurse for every 2 people. Sometimes you have 2 nurses for 1 person. So they're always on your back. It's like being in a zoo. It's all glass enclosed, great big windows over here. People pass by and they look at you. They come to see when your feeding times are. I can see normally when you're going to the restroom. You lose your individuality. You lose being a person. You're a number. You're a disease. Or You know, you're the heart attack person in 3. You're a number. And that's pretty darn discouraging. Gets you kind of scared. When you're in ICU, it's also a place where people have a tendency to pass away. So you'd be laying there, at least I remember being laying there, and I was sort of in the middle of a ward, and it got pretty quiet, and as you lay there contemplating the world and the dust that you have in your belly button, you know, all of a sudden you hear, "Wah!" And you hear a bunch of screaming and people running and the whole family going berserk on it. And as you lay there, you began to realize what just happened. The next door, somebody had just passed away. So all of a sudden you hear and a bunch of crying, and all of a sudden people are moving around, and the whole family kind of crowds out, rushes past your room. And at that point, the reality kind of sets in. They're not playing over here. You realize they're not playing. You know, this is a place for sick people. And what the hell am I doing here? I don't want to be here. This is a place for sick people. So I'm still contemplating and kind of wondering how much dust I have in my belly button when all of a sudden, "Ah!" And what do I find? Someone on the other side of me had just passed away. Once again, the clatter, the noise, the shock carts come over. Bam, bam, you hear. You know, nothing. Family kind of gets up and they all go away. And it gets quiet again. And now the reality is really kind of setting in again. Damn, ain't the place to be. You kind of look around now. How do you get out of here? How do I get myself unwired? Where's my clothes? And they put on this silly gown. Now, a gown is a very, what's the best word for it? It makes you a patient. Just like you're tied up on the back with a couple strings. Your whole butt is sticking out. You can't get any place without pulling your little dress around and tightening it up. And soon I learned that I didn't like to have a gown on. I don't really feel very effeminate, and I really don't like wearing gowns that are open and exposing my backside. Now, they give a lot of reasons. In case you pass away, they can get into you. They'll open this up, and they'll open up that, and they can get to your heart. I just seen what they did on that side, and I seen what they did on this side. And neither one of them worked. So what the hell should I wear a gown for? So from about that point on, as soon as I got out of the ICU, I put my clothes on. A couple things happened. When you have a gown on and you're a number, the doctors will come quite often, or they did at that time, they used to come to the door. And they would talk at you. And you would answer them back. Well, they didn't respond to you, like they didn't hear you. You weren't a reality then. You were just being talked to from a doorway. And it became very impersonal. So what I started doing was dressing up. Normally I'd wear a black turtleneck shirt, black pants, sports jacket quite often, if I could get it over the IVs that were normally in my arms. And I would sit up rather than being in bed. So a lot of times they would take me as a visitor rather than as the patient that's supposed to be laying down dying in the bed. I don't like the idea of being labeled. And labeling to me is really kind of a bad thing. I picked this up a long time when I used to work in rehabilitation. Got a long story to tell you, and you'll notice that I get off the subject all the time. I mispronounce words. I speak in parables, usually with a point. But what I'm going to have to do is I'm going to have to pick up on this again. But what I was trying to get to is I walked for the first time in 15 months yesterday.